It's the conundrum no one seems to have the answer to. How do we fund our precious NHS and maintain its world-class status? We're told the service needs billions of pounds more a year, so much more it could cost every household an extra £2,000 a year by 2033. Milton Keynes University Hospital is under constant pressure. It's treating more patients than ever, and a lack of funds, its chief executive says, is potentially dangerous.
I think it's definitely challenging patient safety, and from a Milton Keynes perspective, we know that the care that we're providing when we're under pressure is much harder to do at the highest possible levels.
Currently, the annual budget for the NHS across the UK is £150 billion. Much of that comes from general taxation, costing an average of £2,500 per person each year. But to improve the NHS for our ageing population, the Institute for Fiscal Studies says up to £56 billion is needed each year. That's an extra 4% of the budget annually. So where could the government get that money?
In the past is that we've paid more and more for the NHS without having to raise taxes, and that's because we've essentially stopped spending much money on defence, on housing, on debt interest. Going forward, very hard to see that there's much left to cut. The only way really is to increase taxes.
But putting up taxes would require getting the public on side.
I'd happily do it. Why not? This is our healthcare, and healthcare seems to be a massive problem in the country right now.
If the household can afford it, then yeah, they should be paying more, and if households can't, they shouldn't.
Yes, the NHS needs more money, and the government needs to fund it.
The government says it is looking at a long-term plan for the NHS. In its 70th year, many feel there is an opportunity to finally fund the service properly. The challenge for the Prime Minister is to decide how and by how much. Emily Morgan, ITV News.